evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights this hour. Lagos State Government adopts new strategy, expands coronavirus testing in the state by enlisting private laboratories. Niger State Government to track, test and treat over 600 Almajiri children in the 25 local government areas of the state. And the World Health Body says the global initiative to speed up development of COVID-19 tests, vaccines and treatment will require more than $30 billion over the next year. Nigeria has conducted over 125,000 tests following the coronavirus outbreak in the country. According to the Nigeria Center for Disease Control, NCDC, the total confirmed cases stand at 22,614 after recording 594 latest cases of the infection across 22 states, including the FCT. In the last 24 hours, 209 cases were discharged in 16 states, 45 in Oyo, 28 in Katsina, 19 in Kano, 19 in Rivers, 17 each in the FCT and Lagos, Gombe 15, Borno 11, Bauchi 10, Plateau 8, Enugu 6, Edo 4, Kaduna 4, Imo 2, Kebbi 2 and Ogun 2, while 7 deaths were recorded in 5 states. A total of 7,822 people have been discharged and the death toll now at 549. So far, the top 5 states with the highest confirmed cases are Lagos, the FCT, Kano, Oyo, and Rivers State. A breakdown of the highest cases in each of the 6 zones shows Lagos, the FCT, Kano leading in their respective regions. Rivers State leads in the South-South with 936 cases, Bauchi in the Northeast with 493, and in the Southeast is Abia State leading with 288 cases. The Lagos State Government says the new strategy that will allow for expanded testing for coronavirus is in the offing in the state. Now, the new strategy, about 1,000 to 2,000 Lagosians will be tested daily, and to achieve this, some private laboratories are being validated for the purpose. The Lagos State Commissioner for Health says by next week the labs will begin testing for coronavirus.
That we've diagnosed over 10,000 cases in Lagos State with our aggressive testing strategy. Now, as you can tell, that is beginning to exceed our isolation capacity in our central isolation facilities, but yet we want to increase our testing capacity even more using the molecular biology test that we call the PCR test. They've all passed with 100%, and so we'll be adding 5 private laboratories to our testing consortium in addition to our already established public laboratories headed by the Lagos State Biobank. So as we now proceed with this expanded testing strategy, we will be testing between 1,000 and 2,000 a day when these labs come on stream, which should be any time from next week. Now, based on our track record and based on our positivity rates of about 20%, and that fluctuates, sometimes it's 20%, sometimes it's 30%, sometimes it even goes as high as 50% of the people that we sample. But that just depends on who presents themselves for testing. So if we start to get large numbers of people that are positive, and as I've spelt out before, and as you've just heard from the Permanent Secretary, we need another strategy for isolation. And that is why we have done 2 things. We've also started to accredit private hospitals who are prepared to join the COVID-19 response. So far, we've accredited 3 hospitals, and we've got about 5 more in the pipeline that want to admit COVID-19 patients and manage COVID-19 cases. At the moment, it is illegal to manage COVID-19 outside of an accredited facility. And you will see the names of the facilities. And therefore, as the public, we implore you not to go to any facility and be treated or tested if they are not facilities that have been accredited by the government.
Still in the southwest, following the rising cases of COVID-19 in Ondo State, the state government is threatening to impose stiffer penalties if residents of the state continue to flout government directives in preventing the spread of the pandemic. The State Commissioner for Health, Dr. Wahab Adigbenro, disclosed this in an interview with Channels Television in Akure, where he's asked the people to indeed follow the safety protocols to protecting themselves. Over 600 Almajiri children from various local government areas of Niger State are to undergo testing for COVID-19. The children who are currently being accommodated at an isolation center at the Minna Hajj camp in Boso local government area of the state are said to be from different states in northern Nigeria. According to the state government, the sample collection will take less than a week, and that those who test positive will be further quarantined and treated in Niger State, and those who test negative will be repatriated to their various states to reunite with their families.
Quarantining our Almajiris from across all the local governments. There has been an agreement between the Northern Governors Forum that all Almajiris from various states are returned to their respective homes of residence. So we have about 604 Almajiris as of today. When they come, we register them and we take their blood samples, and once their results are out, we return them back to their respective states. The major challenge has been with the children themselves, because initially they came scared. They don't know what their fate is going to be, but I'm sure we have tried as much as possible to dignify them. Their welfare has been the paramount priority of the government. They have their square meals, they have their basic needs, so they are believing in us. The stay is going to be very short, and very soon they will return back to their respective states where they would be with their parents.
According to a study conducted on Nigeria's COVID-19 situation, most Nigerians are concerned about the coronavirus outbreak and about food security and poverty. The research says that while most Nigerians are quite versed in the prescribed protective protocols, some knowledge gaps still exist. A breakdown of the investigation shows that 39% of Nigerians think the threat of COVID-19 is exaggerated. 32% feel it's better to take their families to the village and protect them from the virus. 22% think everyone who contracts COVID-19 dies. And 30% think that coronavirus cannot kill. The investigation goes further to say that 27% think that vulnerable groups cannot get COVID-19. 22% believe that drinking alcohol can prevent one from contracting the disease, while 18% say the virus is for the rich. 15% believe that black people, Africans, cannot contract COVID-19. Well, we have joining us via Skype Angela Ambiso, the founder and CEO of InfoTrack Nigeria. We'd like to welcome you. Thank you for joining us on the program.
Thank you.
Okay, tell us what methodology was used to arrive at some of these findings.
Right. As you probably are well aware, because of the requirements, protective requirements and behavior globally, research is not left behind, and for that reason we had to use technology to collect data. So what we've been doing in the various African countries where we operate is we've been using either physical call centers or virtual call centers. In Nigeria, because during the study, part of the time there was a lockdown, we actually built a virtual call center. So our research assistants used, our virtual call center to make calls using the vast database that we have of, respondents who represents the Nigerian population. So therefore, the methodology was computer-assisted telephone interviews.
So, looking at some of the investigations and the results, do you think that most people feel removed from the coronavirus pandemic in Nigeria?
I think yes, because, whilst you have so rightly put it, that majority of Nigerians, 66%, feel that coronavirus and the pandemic is the main issue that government should handle as a matter of priority. We also see that from the knowledge gaps, they don't feel that the virus is something that is very close to them. When you see that 4 in 10 Nigerians think that the virus is an exaggeration, and all these things that you're reporting are perhaps just myths, then it begs the question, do they really, feel that it's something close to them? But even more importantly is that the finding, one of the findings that we have in the study is that an overwhelming majority, 74% of Nigerians actually believe today that the virus cannot afflict them or someone in their family. That means that for them, that is a virus that affects other people and not people close to them or themselves.
Tell us more about the demographics, especially what the awareness is when you compare the men to the women, those that might have, those that are married from those who aren't, and some of the responses.
What we see is because women are caregivers, natural caregivers, then, they have paid a lot more attention to the pandemic as a health issue as opposed to the men. Men are more risk prone, so we do see that in terms of them wanting the economy to open up, for business to go back as usual, for them saying that you can actually take a tot of vodka or a tot of brandy and you should be protected from the virus is higher from the males than we see from the females. But also because at the onset of this pandemic, we heard from the experts all over saying that young people were less susceptible to being afflicted by the virus. We also see higher risk behavior from young people who tend to think that because they're young and healthy, they're less prone to, getting the virus than one would see, people who are older and have pre-existing conditions. We also see the same with rural versus urban. In the rural areas where the pandemic is still very removed, many people are saying, do you really know anyone with this disease? And if you don't know anyone, does it really exist? So we see those demographic differences by rural, urban. We see them by, gender. So females are more, concerned and more, informed. And we also see it between the youth and the older population. In fact, the older population is very concerned about the virus.
All right, hopefully this will definitely assist government in bridging the knowledge gap that exists on COVID-19. We'd like to thank you, Angela Ambitho, founder, CEO, InfoTrack Nigeria. Thank you for joining us on the program.
Thank you for having me.
Less than 24 hours after 167 Nigerians who were stranded in South Africa due to the coronavirus-induced lockdown arrived from Johannesburg, another 145 citizens have returned from Sudan. They arrived in Nnamdi Azikiwe International Airport at about 12:45 p.m. today via Air Sudan. This was announced in a tweet by the Nigeria Diaspora Commission, NIDCOM. The returnees are to proceed on a 14-day self-isolation as mandated by the NCDC, the Ministry of Health, and the Presidential Task Force on COVID-19. Still to come, we have more on the COVID-19 updates when we return. Stay with us. more enlightenment is key to the COVID-19 fight, and this is coming from the head of pharmacy department of Socorro District Hospital, Abuja, Mr. Peter Enemari. He told Channels Television that most people are still living in denial about the existence of COVID-19. He warns about rising cases if nothing is done to improve the current level of awareness.
One of our biggest challenges right now is public enlightenment. Very many people are not aware, and very many people do not even believe that the pandemic is with us, because the enlightenment seems to be a little bit low. So we need to step up on public enlightenment, and then advocacy has to go on as has been started by the NCDC. When people come with symptoms, they manage the symptoms. Because for now, like we're told, there are no specific treatment for the COVID-19. So that is exactly the same way, the same thing that goes on there in the Socorro District Hospital for now as a treatment center.
The governor of Delta State, Dr. Ifeanyi Okowa, and members of his family are in isolation for 14 days after one of his children tested positive to COVID-19. This was confirmed in a statement by the Chief Press Secretary to the governor, Mr. Olisa Ifajika, who says efforts are being intensified to stop the spread of the virus in the state. The state government insists that the virus is real, reminding residents to be disciplined and comply with all the protocols as specified by the NCDC to ensure their safety. In the meantime, the Niger Delta Development Commission, NDDC, kicked off the distribution of medical equipment and food palliatives to 25 local government areas of the state, flagging off the distribution in Uheli South Council area. The acting managing director of the NDDC, Professor Daniel Ponde, said that the COVID-19 pandemic created a health emergency and pangs of hunger the world over, particularly in the Niger Delta region, which has necessitated the need for all hands to be on deck to fight the virus with all available resources. Now, according to the World Health Organization, the global initiative to speed up the development and production of COVID-19 tests, vaccines, and treatments will require more than $30 billion over the next year. Providing details of the ACT Accelerator launched in April and aimed at pooling international resources to combat the pandemic, the UN Health Agency says so far $3.4 billion have been pledged, pointing out that an additional $27.9 billion was needed over the next 12 months, including nearly $14 billion to cover immediate needs. The announcement is coming ahead of a major pledging event in Brussels to support the COVID-19 Tools Accelerator. Nigeria's former finance minister and special envoy for the ACT Accelerator, Dr. Ngozi Okonjo-Iweala, told a virtual briefing that this is an investment worth making and that if we don't rally now, the human costs and the economic pain will deepen. Here's more on our global update.
The United States has recorded an all-time daily high of 40,000 coronavirus cases on Thursday, June the 25th. U.S. health officials have also said they estimate the true number of cases is likely to be 10 times higher than the reported figure. The U.S. has 2.4 million confirmed infections and more than 124,000 deaths, more than any other country. The recent resurgence has resulted in several states halting their reopening plans.
I believe if the numbers continue to rise at this pace, Houston is on track to become the worst affected city in the United States.
In Italy, dozens of riot police and soldiers have been sent into the southern city near Naples to subdue disturbances after over 40 people tested positive for the new coronavirus in a residential complex. Now, 700 people have been placed in a so-called red zone quarantine for 15 days by the regional governor. Clashes between the foreign workers and locals began on Thursday as the Bulgarians tried to leave the zone to go to work. Over in Britain, after thousands descended on the beach to beat the heat in Bournemouth East, the MP is calling for the creation of a National Situation Centre. MP Tobias Elwood added that Britain needed to make sure no beach looks like it did this week until there is a vaccine. Mexico has now recorded 25,060 deaths and just over 200,000 cases of COVID-19 after passing Brazil's daily death toll record on Sunday, June the 21st. Mexico's daily death toll for coronavirus surpassed Brazil amid concerns that Latin America's second biggest economy is not doing enough to flatten the increase in infection rates. In the Middle East, it's been estimated that millions of children in Yemen could be on the brink of starvation resulting from the significant drop in aid caused by the COVID-19 pandemic. UNICEF says it needs almost $500 million to save children in a country the UN declared the world's worst humanitarian crisis. Yemen has reported 564 cases of COVID-19, but the figures lag and may not include all cases in areas controlled by the Houthi authorities in the north.
Well, let's quickly join Dr. Valentine Omoifo, a consultant hematologist at Ira Specialist Teaching Hospital. He's also the chairman of the Nigerian Medical Association Edo State branch. He joins us via Skype. Well, I'd like to thank you for joining us. Let's first get your perspective on the virus spread in Edo State. What have you observed?
Thank you very much for having me. We know that the virus seems to be peaking very fast in Edo State. The rate of new cases is increasing tremendously on a daily basis. But this is not surprising because we're having a lot of community transmission currently, and it's just keeping with the trend. And like we said, it's also not unconnected with the fact that many people in the state currently are not abiding, by the guidelines provided by the government. Also, we've noticed a lot of poor compliance and enforcement by officials.
We understand that Ira Specialist Hospital, has been at the forefront of the COVID-19 fight in the country with tests management since the beginning, April. How would you compare, and this is from the first case as far back as April to now, the situation?
Thank you very much. Like you know, Ira has been on the forefront because of his expertise in managing the infectious disease from the Lassa fever epidemic. Now the hospital is doing its best. It has improved a lot in its capacity, but currently the issue of shortage of materials, particularly swab sticks and transfer medium for the viruses, is actually like most other laboratories in the country. But I must commend the management of the hospital, alongside its I think they are very, very management. They have a lot of cases of admission currently, and many have been treated and discharged.
Okay, we appear to be having some audio problems, but we appreciate your time, be it very short. Dr. Valentine Omoifo, consultant hematologist at Ira Specialist Teaching Hospital. Thank you for joining us. Now, face shields without face mask are not effective in the COVID-19 prevention. Face shield protects only the face, but face mask curbs the spread of respiratory droplets. You can find the latest guide on the NCDC website on keeping safe and take all the necessary precautions to prevent COVID-19. Also, the World Health Organization has the latest updates on the global response to the COVID-19 strategy. Their website guides the public health response at national and subnational levels, including practical guidance for strategic action. ChannelsTV.com, that's our website. It has more updates. You can find the latest on the pandemic in Nigeria and across the world, plus other stories. That's a COVID-19 update. Thank you for watching. I'm Millicent Walker. Stay healthy, stay safe.